name is Sarah and I'm a technician at Dove Lewis, and I'm going to teach you how to give sub-Q fluids to a cat. So Vivian here gets sub-Q fluids at home, and that's just to supplement her ongoing veterinary care. So there are times that your veterinarian may prescribe sub-Q fluids to be administered at home just to keep your animal really hydrated. And what sub-Q means is subcutaneous, which just means underneath the skin. So we don't do this in human medicine, but in veterinary medicine, animals have a lot of space underneath their skin between their body. And it's a really great place to put fluids that helps it absorb slowly over time, that doesn't require something like an IV catheter. So your veterinarian, when they prescribe sub-Q fluids, they're going to be sending you home with a bag that's going to look something like this. So this is the bag of fluids, and what's inside is basically like sterile water that is safe to give. This is a primary line that hooks up into the bag, and the fluids run through them all the way to the end, which has a needle on it. What we do here is we leave a dirty needle on it, and when it is time to give the fluids, we'll switch and put a clean needle on for administration. Each time that you're giving fluids, whether that's once a day, once every other day, or even once every 3 days, we're going to put a new needle on every time we poke the animal. Needles can dull really quickly, and they can carry bacteria and stuff, so we want to make sure we're using a really clean needle every single time. Okay. How to read this bag. So there's these little gradient markers on the bag, if you can see those there. So when you get to this line here, it means 100 mils has been given. This means 200 mils has been given. And this one here means 300 mils. Cats often will get 100 or 50 mils. So right now, we're at about 50 mils given. And if I wanted to give another 50 mils, I would go to the 1. Next time, if I wanted to give another 50 mils, I would go halfway between the 1 and the 2. When you hold the bag, that line goes up and down, so it's best to read this when it's in a neutral kind of hanging position to be the most accurate. One thing we always recommend owners do is put your fluid bag on a hanger. Wire hangers can be really beneficial to free up hands if you're doing this by yourself. So you can put it on a wire hanger and hang that on a cabinet or a bookshelf or something like that, just to free up your hands. This will flow, depending on the speed it'll flow, will depend on the size of the needle and also how high it is, because gravity can make it go faster. So we're going to hang this up to help the fluids go in a little bit quicker, and then I can still see where it is. Also on this line, you'll see these clamps. So there's 2 clamps that keep it from leaking all the time. This one, when it's in this down position, it means it's locked. And if we were to roll that up, it would open the line. There's another clamp here, this blue clamp right now, that's in a locked position. And when you open it up there and unclamp it, that will help the fluid go. I like to keep both of those clamped just to be sure that I'm not leaking her fluids all over. But that's kind of the basic introduction to fluids. Before I administer fluids, I like to make sure that cats are in a place that is comfortable and feels safe. So Miss Vivian likes her bed. She also likes to be by windows. And when they are comfortable, they're going to just tolerate the injection a little bit better. So keeping them in a cozy space can be really helpful. If your pet is eating well or really food motivated, giving them a snack during the injection can also be helpful to make it a positive experience and keep them kind of distracted. This isn't a procedure we think of as uncomfortable, but there is a little bit of a pinch feeling in the beginning, and then when the fluids go in, it feels a little bit cold. So they may react a little bit, but it's not something we think of as a very painful procedure. If at any point they're acting painful, we should stop and think about replacing our needle in a new spot. So how to know where to give the fluids. My favorite spot is between the shoulder blades. So if you feel when you're petting, you should be able to feel the shoulder blades of the cat, and you can pinch the skin. They have a lot of extra skin here, and lift it up, and you're creating like a little triangle tent. And you're going to be putting the needle kind of in between your fingers underneath the skin. Okay, so this is maybe a little bit hard to see, but when you feel it on your pet, you should be able to feel a really good spot. So I'm pinching and lifting up, and I'm going to be going in kind of between my fingers, parallel to the body wall, but we're not going to be poking it kind of directly down. Okay. We're almost ready to get the fluids, and I'm going to switch out my needles. So to switch off your needles, you're just going to twist, safely dispose of the needle, open up the new needle, and without touching the ends, you're going to put it on and twist to lock it into place. So the new needle is ready to use, and I'm going to get Vivian a snack to see if she wants to eat during her fluids. So I'd like to save a really high, one of her favorite, a high yield or really favorite snack for this procedure, and only give it to her when she's getting her fluids, just so she has a really positive association. Here's your snack, Vivian. Okay, so she is excited for that. Now I'm going to uncap my needle. I'm going to pinch the skin here and create that tent. A little bit here. I'm going to put the needle in, just like that. While holding it with one hand, I am going to go unclamp the line. So I'm clamping here, but remember there's two safety mechanisms. And then I'm going to clamp this guy by rolling it up. And there it's open. And now you can see that the fluids are dripping into Vivian here. So we're going to let that drip and allow the fluids to go into that space underneath her skin. It usually takes about 15 minutes. It really depends on how much space they have and the volume that you're giving. So it can change and depend on the patient a little bit. Okay. Now that I've delivered the amount that I wanted and that was prescribed by the doctor, I'm going to go ahead and clamp this, and I'm going to pull this rolly thing down. So we have two safety locks on. And I'm going to take the needle and I'm going to pull it with pinching behind it and pull it directly out. Okay. Then I'm going to just hold that for a second to kind of seal up that entry point of the needle. And I'm just going to give her a minute and talk to her about what a great girl she was. I'm going to make sure that none of those fluids are leaking out. You can put a little gauze or a little towel on there. And if they leak out, it's okay. And if you see a little bit of blood, that's okay too. The skin has a lot of vessels that go in, and sometimes it can be normal to see a little bit of bleeding, but we tend to not see very many complications to this procedure. That is going to create a bump that kind of looks like a camel's hump when you give a volume. Hers was only 50 mils, so you don't see a ton, but that will get absorbed slowly over 12 to 24 hours and will kind of migrate and shift. So it might get absorbed down into our armpits or our legs where you can feel the fluid bump later. But that's how you give sub-Q fluids to a cat.